Okay, hi everybody. My name is Sidney Kennard Sheldon. I am one of the group members of the Heterosexism group. My partners were Helen Miller and Grace Tuman. So we are excited to present to you our poster about struggles of the LGBTQIA+ community. So our abstract just says, in the world that we live in today, things can seem better than they really are. How have opinions and policies evolved or not evolved for the LGBTQ plus community now in 2021? The way that we treat people can change them for life, not to mention, as social workers, we should approach every individual with no bias and lots of compassion. This is all about some hidden struggles that the diverse community goes through in their lives, particularly relating to discrimination, healthcare, and mental health disparities. So kind of the background and the reason, the purpose of the study. So the reason that we kind of decided on this topic and study was because we have all witnessed the struggles that members of the LGBTQ plus community sadly have to struggle with daily. So how does this, sort of affect members of this community? And we just wanted to kind of know why people maybe that aren't part of this community lack this understanding. Like, what can we do better to educate them about it? So for our study method, for our hypothesis, is from the research we have gathered, there are many people who lack an understanding for people a part of this diverse group. This uneducation leads to bias and discrimination on a personal level, which is homophobia, as well as systemically shown in healthcare disparities and mental health misconceptions. And our target population for this project was those who are ignorant the struggles of the LGBTQ plus community. As well, I just want to talk about our issue statement. So people outside this community have a lack of understanding of the issues that this group deals with. As well as that, they also lack the wanting to understand those issues. Because of this ever-growing stigma, the LGBTQ plus community has many underlying issues, including, as I've mentioned before, inequalities within healthcare, an increased number of mental illnesses within people in that community, and discrimination such as homophobia. So, our method, so we did all of this research about different topics and then met with each other, about what we discovered. So this kind of helped us learn about, the different topics on the issue. So when we presented and educated the class, we all had a good understanding of all of the different things we were going to talk about under this umbrella of the LGBTQ plus community. So our findings for that, so we found lots of information about homophobia, just kind of defining that, as well as I've written here, we talked about mental health and how in our 2017 study, it shows that 1 in 3 LGBT teens have mental illness. This is a study in England for 14 to 19-year-olds, and it just is kind of talking about, and we can see from the numbers just how many more of those people who are part of this community have struggles with their mental health, which I definitely think is not a coincidence. As well, I did discuss that LGBTQ people who live in communities with more stigmatizing attitudes about their sexual orientation die an average of 12 years earlier than those LGBTQ people who live in less prejudiced communities, which is just a really sobering fact. I think that is just so sad, and it's definitely something that we should talk about more. I did also look into healthcare disparities, so looked at some different surveys, and this 2019 study here at the bottom, nearly 1 out of 5 people in this community avoid seeking medical care due to the fear of discrimination. So just the sheer fear of the discrimination going into the doctor's office prohibits them from even going, let alone, as Wiley talked about, discrimination that LGBTQ doctors also experience, not just students. So I think that's interesting to note as well. Our study limitations, so it was hard to find personal testimonies just because it's not a new topic, but it's definitely something that people are having to become more comfortable talking about, as well as this is an actively researched discussion that we're kind of having right now. So it was at times difficult to find completely updated information just because it's changing so quickly. As well, his historical relevance, we just feel like it wasn't as relevant in history as it should have been, so it was at times hard to find the information we needed. We also had trouble finding Ohio-specific resources, just because we really wanted to kind of show those off since that's where we're researching from, but that was difficult just because it's such a broad topic. And then a lot of our resources became repetitive. It was hard to find some things that were kind of diverging and different from the topic. So our implications for social work practice here at the bottom left corner we have, so for micro, we kind of discussed that we could, like, if I was a social worker and I was using these practices, I could counsel an LGBTQ person of youth one-on-one and address their specific issues relating to that. For meso practice, I would work in an LGBTQ plus youth center and give presentations on discrimination for the community. And then for macro practice, I could work alongside policymakers and lawyers and create legislation specifically to advocate for this really diverse, amazing community. And then lastly, for our conclusions, so we just kind of wrote, while these problems are being addressed, they are still ongoing. Mental health is a huge and important problem within the LGBTQ plus community. There's a huge lack of education within the healthcare system, and patients often feeling discriminated against because of their sexuality, whether it is intentional or not. Homophobia is seen everywhere. A lot of people are raised in households and religious communities where this is seen as wrong. Social workers are really needed in this community to be there to help educate others outside the community. And then at the bottom right corner are just our references. So there you have it. There is Heterosexism, Struggles of the LGBTQIA+ Community.